We'll look at another surgical procedure today, and this surgical procedure, the short form that they usually call it is is down here. So they usually call it TIPS, and the full name is what? Transjugular Intrahepatic Portosystemic Shunting. All right. So we'll look at this surgical procedure. We get to look at the indication, the contraindication, the procedure, the types of these transjugular intrahepatic portosystemic shunts that we have, the complications and advantages that could actually follow this procedure. So this transjugular intrahepatic portosystemic shunt is a minimally invasive procedure which is trying to create a shunt between the hepatic vein and the portal vein. All right, and you are doing this to reduce portal hypertension. All right, so you are trying to create a shunt between this hepatic vein and the portal vein. All right, doing it most of the times because there's portal hypertension. All right, so you want to reduce the portal hypertension. All right, so it's a surgical procedure to reduce portal hypertension. All right, so indications now, like which type of disease condition will you actually do this type of surgical procedure? When there's refractory arthritis, in is actually means let me say you have ascites that is coming back. Okay, refractory is reoccurring. Then if you have variceal bleeding, if you have hepatic hydrothorax, if you have portal hypertensive gastropathy, you have the Budd-Chiari syndrome. Okay, then contraindications, when you shouldn't use this, right? Like when you shouldn't do this procedure or when you should wait first. If there's severe liver dysfunction, there's heart failure, there's pulmonary hypertension, if there's portal vein thrombosis, if there's hepatic artery thrombosis. Then for the procedure, how can you be able to do this procedure? Yep, you could see that well, you could actually access this side using the femoral vein. Okay, where there's a femoral vein access, then you place the guide wire. All right, this is a guide wire. Okay, but this one you see that the access is through this side, but the femoral vein, that means you are coming from down. Okay, if you want to access it from down, then you place the guide wire, then there will be hepatic vein catheterization, there will be portal vein puncture, there will be shunt placement. Okay, place your shunt. What are the types? There's a bare stent, there's a covered stent, there's a polytetrafluoroethylene type of shunt. Okay, then you see that just a reminder, is a surgery to connect the portal vein to a branch of the hepatic vein, and you are doing this to reduce portal hypertension. So complications now of this surgery. If not done well, the shunt could become dysfunction. Could lead to things like hepatic encephalopathy, infections, bleeding, that's hemolysis, and hepatic artery thrombosis. Okay. Advantages. Yes, it will reduce the portal pressure, to decrease variceal bleeding, it will improve the ascites management. There is a minimal invasive procedure. Of course, it can be repeated because it's minimally invasive. Disadvantage is that it requires special equipment. It requires trained interventional radiologists, because not everybody can do this. Not every surgeon can do this. It may require multiple intervention, and there's risks of shunt dysfunction. Right. So that's it for tips, which is transjugular intrahepatic portosystemic shunt.